Noma is a disease that disfigures the mouth and face, affecting mostly children between the ages of 2 and 6 years who suffer from malnutrition and live in extreme poverty. Health correspondent Kemi Balogun explores the life of a survivor who still lives with the scar of this childhood disease.
Living with my grandparents before I was affected by this Noma.
Mulikat is in her mid-40s. She tells us about how her life turned out after the discovery that she had Noma disease while living with her grandparents when she was 6 years old. Despite her struggle with stigmatization, she grew to become an advocate for Noma.
I had about 5 surgeries in the next 20 years before getting to this present stage. After that, I finally began to admire myself, had to take picture of myself and relate with people in the community.
Noma is a non-infectious and mostly neglected disease, mainly widespread in sub-Saharan Africa, but some cases are also recorded in other parts of the world. In Africa, 15 to 60% of the high prevalence rate of acute Noma in children is found mainly in the south of the Sahara, depending on the region and the degree of poverty. Countries that form the Noma belt of the world are Burkina Faso, Ethiopia, Mali, Niger, Niger and Senegal, which are the most affected countries due to an estimated annual occurrence rate of about 20 cases per 100,000 people.
People that have had the condition usually die within 10 to 14 days.
Dr. Peter works at the Noma Children's Hospital in Sokoto. He tells me more about the disease and its risk factors.
It's an inflammation of the gum that have the capacity to prolong or progress into soft tissue, affecting the soft tissue of the face and mouth, as well as hard tissue like bone structures. For people who have been able to survive that age with Noma, they prolong or they progress into adult life with a very remarkable scar.
Survivors of the acute phase like Mulikat present with severe facial deformity, leading to social stigma and isolation by many. After treatment, many still need to go through a series of physical and mental therapy to enable them eat and speak better, as well as live a more improved life. Noma is fatal in 70 to 90% of all cases due to dehydration and malnutrition within 2 weeks of the onset of the disease, so experts advocate for early detection and intervention. Kemi Balogun, TVC News, Abuja.